This is the first session that describes the mechanics of breathing. The learning objectives are to review the mechanism of respiration and to describe the mechanics of breathing. Remember that respiration is the process of inhaling oxygen and exhaling carbon dioxide. It's divided into external respiration and internal respiration. And for the external and internal respiration to occur, it goes through four processes in the form of pulmonary ventilation, exchange of gases, transport of the gas, and then the regulation of breathing. How is respiration done? Actually, when we inhale oxygen and exhale carbon dioxide, we're doing what is known as respiratory cycle. The respiratory cycle is composed of short inspiration, longer expiration, expiratory pause where the glottis is closed. The respiratory cycle has a rate. The rate of respiratory cycle is about 12 to 16 cycles per minute. Starting with inspiration. Inspiration is an active process where there is muscle contraction. The muscle that contracts during quiet breathing includes the diaphragm. The diaphragm, when it contracts, it pulls the central tendon downwards. This increases the length of the thoracic cavity by 1 centimeter. The contraction of the diaphragm is responsible for 75% of the process of inspiration. Not only the diaphragm contracts, but also there is contraction in the external intercostal muscle. When it contracts, it pulls the ribs upward like the handle of the bucket. This is due to the direction of the fibers of the external intercostal muscle. When the diaphragm and the external intercostal muscles contract, all the diameter of the chest will increase, the anteroposterior, the transverse, and the vertical diameter. Thus, the volume of the thoracic cavity will increase. The increase in the volume of the thoracic cavity is accompanied by decrease in its pressure. So the pressure inside the thoracic cavity will be less than the atmospheric pressure. Air will move from the high pressure in the atmospheric pressure to the low pressure inside the thoracic cavity, and this is inspiration. It's important to know that inspiration is always an active process, even in quiet breathing. There is contraction of the diaphragm and the external intercostal muscle. Although the diaphragm is responsible for 75% of the process of inspiration, yet if it is paralyzed, the external intercostal muscle alone can produce inspiration needed for moderate activity. Now the question is, what happens during deep breathing, deep inspiration, just like during muscle exercise? What happens is there is more contraction of the external intercostal muscle, more contraction of the diaphragm. It can descend up to 7 centimeter in comparison to what happened during the quiet breathing, which was 1 centimeter. The contraction of both muscles, the external intercostal muscles and the diaphragm, is accompanied by contraction of the accessory muscles of inspiration, which are sternocleidomastoid, serratus anterior muscle, scaleni muscles. The contraction of all these muscles during deep inspiration will lead to increase in the diameters of the chest, the anteroposterior diameter, the transverse diameter, the vertical diameter, thus decrease in the pressure inside the thoracic cavity, allowing air to rush in as inspiration. Now coming to the expiration. Expiration during quiet breathing is a passive process. It does not need muscle contraction, and it's due to the elastic recoil of the lung and the chest wall. So what happens is there is relaxation of the already contracted muscle during quiet inspiration. So there is relaxation of the diaphragm, relaxation of the external intercostal muscle. So the volume of the thoracic cavity will decrease. The decrease in the volume of the thoracic cavity is accompanied by increase in its pressure. So the pressure inside the thoracic cavity will be higher than the atmospheric pressure, and air will move from the high pressure to the low pressure. That's why there is rush of air from the thoracic cavity to outside, and this is expiration. Now we should ask an important question. Is expiration process always a passive process done by relaxation of the muscle and elastic recoil of the lung and the chest wall? The answer is no. Sometimes the expiration process is an active process done by contraction of the muscle. And this is when we need to do forced expiration, such as during muscle exercise, or if there is bronchial obstruction, such as cases of bronchial asthma, or if there is decrease in the lung elasticity, such as in the emphysema. Here, in the forced expiration, we need to have certain muscle contracting to force the expiration. The muscles that contract during forced expirations include the internal intercostal muscles. Due to the direction of the fibers of the internal intercostal muscles, when it contracts, it lowers the ribs, decrease the transverse and anteroposterior diameter of the chest. Also, there is contraction of the abdominal wall muscle. When it contracts, it increases the pressure inside the abdominal cavity, pushing the diaphragm upward. Now, during forced expiration, when the internal intercostal muscles and the abdominal muscles contract, there will be decrease in the chest diameters, the transverse, the anteroposterior, and the vertical diameter, thus increasing the pressure inside the thoracic cavity, pushing the air by force to outside, and this is forced expiration. Now remember that inspiration is always an active process, even during quiet breathing, and expiration is always a passive process unless we need to do forced expiration. By this, we finish the first session that describes the mechanics of breathing. Hope that you enjoyed it. Thank you.